In this hour, I wanted to get into this question of death panels. We can call it that. I mean, you know, why aren't these selfish anti-vaxxers, the people who say, you know, oh, I'm going to do my own research on the internet and find out about this stuff, and I know better than the doctors do, or the FDA or the CDC. And ouchie Fauci and all that, and so I'm gonna, you know, and then they end up in the hospital. Why aren't they the ones whose health care is being rationed? It's actually, I mean, it's starting in Idaho, right? Brad Little is the Republican governor of Idaho, and he had activated members of the National Guard because we've got this happening. One of my kids, the weekend for our daughter's birthday party. There's National Guard in the hospital where she works. I mean, it's like the National Guard is here to help out. Part of it is that, you know, there have been several thousand doctors and nurses who have died in the last year and a half of COVID, number one. Number two, people just experiencing extreme burnout, and some of them leaving the profession. And then number three, we have a healthcare system that was designed in large part since the 1980s to maximize profit and efficiency, and it just was not prepared for a pandemic. And so as a consequence of this, we now have, Idaho has now officially gone to crisis standards of care. What that means is that hospitals are in the triage process, in the initial evaluation process of bringing people to the hospital, they're asking the question, okay, we've got 8 beds, we've got 12 people. Which 8 of these 12 people are most likely to survive? They get the beds. The other 4 people, you guys, you can sit in the waiting room. Maybe we can find you a cot in the basement. You can go home. But you're not going to get the echo machine. You're not going to get the intubation. You're not going to get the, you know, because we don't have it. Hawaii is very concerned that they may have to move to the same thing, you know, fairly quickly. The director of one of these hospitals in Idaho, his name is Dave Jepson. He said, crisis standards of care is a last resort. It means we have exhausted our resources to the point that our healthcare systems are unable to provide the treatment that we care and expect. Now, what's happening in Idaho? You know, well, it could have something to do with the fact that in Idaho, only 40% of people are hospitalized. And it's, by the way, you know, up to this moment, you know, in the 4 minutes here I've been talking, I've been putting this in the context of COVID. But really, there's a much larger context here. Hospitals are normally empty, right? I mean, you know, certainly typically there's a certain number of available beds and things like that. But, you know, we still have car accidents. We still have people getting diagnosed with cancer. We still have people breaking their bones. We still have people who get pneumonia from things other than COVID. We still have diseases that require hospitalization. Betsy Phillips was one of those people. She had a surgery scheduled on Friday. She's got something going on in her chest that is progressively getting worse and worse. They don't detail it in the article. My guess, you know, from reading the articles, it's some sort of a benign tumor because it's constricting her ability to breathe. It's cutting off her ability to breathe. And she was going to have surgery on Friday to take care of this. And they called up and said, I'm sorry, we can't do your surgery. And she's like, why can't, you know, I mean, you know, in a few months, I might not be able to breathe at all. I mean, you know, why can't you do my surgery? Because our hospital is filled with COVID people who are unvaccinated. And by the way, let's be very, very clear. Well over 90% of all the people in the hospital who have COVID are unvaccinated. And in some cases, it's well over 95%. And the people who are getting COVID and are in the hospital and are dying tend to be people who are well over 70 years old, have pre-existing conditions, and in many cases, because of their age, because of their pre-existing conditions, you know, their bodies just didn't take the vaccine and create the kind of immunity that a younger, healthier person would, or even an older, healthier person would do. So bottom line, for those of us who are reasonably healthy and got our vaccines, we're not the ones showing up in the hospitals. We're not the ones who are dying. There's this very small subset of people who are vaccinated who are very old or very sick who are in the hospitals or dying of COVID. But the vast majority of them, well over 90%, in most states, well over 95%. I've seen in one hospital, it was 99%. In another hospital, it was 100%. I did that report for you yesterday on this program. 100% of the people who were in the hospital and 100% of the people who had died in that hospital, I forget what state it was now, it was down south, were unvaccinated. So we've got these selfish SOBs out there, or deluded or sad or, sadly deluded. I mean, I have very mixed feelings about this, right? The people who, they go on the internet to get their medical advice and they decide not to get vaccinated and to take, horse deworming paste to keep themselves safe. Like, they don't believe in science and they know better than doctors. But then as soon as they can't breathe and their lips start turning blue and their blood oxygen is going below 80% and they're in a crisis, what do they? Take me to a hospital. Suddenly they believe? Anyhow, this Betsy Phillips, this was published in the Nashville Scene yesterday, Tuesday. She was told, sorry, your surgery is not going to happen. She says, until Friday, I can't remember the last time I cried so hard. She was told, you'll be among the last surgeries to be canceled with COVID due to how dire your situation is. She said, I did everything asked of me for the past 18 months. I did my part to get COVID over with as quickly as possible. In other words, she got vaccinated and she stayed away and she wore masks and things. And all these people who did not do their part are clogging up the hospital. They are selfish ass blanks. She said, F them. I'm so pissed. If you're, and then she goes on to say, if you're too sick to do it, but unvaccinated COVID patients should have to be the ones to call people like me. This is an interesting thought. She said the problem is, of course, most of these people in the hospital who are unvaccinated are too sick to make a phone call. But if they're not too sick to make a phone call, instead of the nurse calling her and saying, I'm sorry, we can't schedule your surgery because we've got a bunch of unvaccinated fools here in the hospital, she said it should have been the unvaccinated COVID patients should be the ones to call people like me and tell us that we can't have the surgery we were counting on because of them. And my God, can you imagine the trauma of having to call multiple people and hearing them all in despair? She watched a video of the governor. This is happening in Nashville, Tennessee. Lee is the Republican governor. And there's this video that's kind of gone viral. It's all over Twitter and whatnot of Bill Lee being chased down the hall, essentially, by the press, who are asking him, why will you not allow schools to at least mandate masks for kids? And he's literally running away from the press. And she says, I was feeling utter contempt for him. She goes on to say, the unvaccinated in this state have told me, literally, but this is the message they're sending. The unvaccinated in this state have told me that they will harm others to get their way. I have evidence based on my own experience that this is true. I have been harmed now by people refusing to get vaccinated. I will be very wary of them for the rest of my days. Patient, the article is by Bob Brigham over at rawstory.com. Patient livid after hospital cancels surgery due to COVID surge. I cried so hard I had a headache. This is happening all over the country. And remember the Republicans who were all hysterical, and the Tea Partiers, all those white people out there in the Tea Parties, because the black president was proposing national health care. Death panels. Oh, my God, Sarah Palin. Oh, my God, death panels. And now hospitals are actually doing this.
This is the Thom Hartmann Program.
These hospitals are having to decide who's going to get health care and who's not, thanks to these Republican lies about COVID and about horse paste?